Hi, welcome to Facebook.
Hi, how are you doing, Jim?
Good, Misha. What are we going to talk about today?
We're going to talk about supplements.
Oh, there's so many.
There are very, very many supplements. Well, Jim, if you could think of 2 supplements that everybody should have, what would you say?
Yeah, because there's so many and people have a limited budget. There's 2 that if you only had enough money for 2, the 2 that I would say you'd have to be on. The first one is, I just happen to have a bottle in my pocket, vitamin D. You can get vitamin D 1,000 IUs or 2,000 IUs. And especially this time of year when the sun's not as out as many hours as it was a few months ago, and you go into daylight savings ends, I always start this when daylight savings ends and continue it through the winter. And then once that's over, we go back to daylight savings, I usually cut it down to 1,000 IUs from 2,000 IUs. But vitamin D is so important, not only for bone health, it's helpful for brain. Studies have shown that it helps reduce depression. It has a lot of benefits for the body. It's also the building block of most of our hormones. So that's the first one I'd say you really got to get. The other one is fish oils, and there's so many different types. We have a brand, Omega-3 Ocean Blue, which has very few impurities in it, if any. You do not burp up fish when you take it. But omega-3s, especially the Western diet in the United States, is lacks in omega-3s. And if you can get on this, it helps with the brain, the heart, bones, eyes. I take it, I had arthritis in my joint, and I just took this and nothing else, and the swelling went down. It's Mother Nature's anti-inflammatory omega-3s, fish oils. So these 2, if you can only afford 2, these are the 2 I'd say you got to be on.
Very neat. Well, thank you, Jim.
Okay,
That's awesome.
I'm going to go take my pills.